So you're wondering if Medicare covers vaccines like the RSV vaccine. Well, the short answer is yes. However, with all things Medicare, it's a bit more complicated than that. There are two pitfalls that you need to know about, and if you aren't careful, you could end up spending $330 per RSV shot when you could have gotten them for free. I'm Calvin from PlanFit, and I've been helping seniors avoid costly Medicare mistakes for many years now, and in this video, I'll go over everything you need to know about how Medicare covers vaccines, and particularly the RSV vaccine. And stick around to the end because I'll go over the two big mistakes that can cost you a lot of money on vaccines. So to understand how Medicare covers vaccines, we first need to look at the difference between Medicare Part B and Medicare Part D. Medicare Part B is the branch of Medicare that covers your outpatient costs. So if you visit a doctor's office, typically Medicare Part B is what's covering you there. And if you get durable medical equipment like a wheelchair, Part B will help you pay for those costs. But aside from that, Medicare Part B is also responsible for a few select vaccines. These include seasonal flu shots, pneumonia shots, COVID-19 vaccinations. It also will cover the hepatitis B vaccine if you're considered at high risk for the virus, and any other medically necessary vaccines. So if you step on a rusty nail, then Part B will cover your tetanus shot. If you're bit by a dog or some feral animal bites you, Part B will cover the rabies shot. Part B, however, does not cover the RSV vaccine. So why am I talking about the Part B vaccines? Well, you'll see why in just a minute. But one of the best things about the Part B shots is that they're 100% covered by Part B. Now, these are the only vaccines that Part B covers. All of these vaccines are administered in doctor's offices. So take note of this because that's really important and you'll see why here in just a bit. But again, these 5 are covered by Part B. Everything else, all the other vaccines, they're covered under Medicare Part D. Now, Medicare Part D is the branch of Medicare that is all about prescription drugs. Part D plans are provided by insurance companies that work with Medicare, and it's important to note that enrolling in a Part D plan happens separately from enrolling in Medicare. You either enroll in a standalone Part D plan or in a Medicare Advantage plan that has Part D in it. But if you have a Part D plan, you can get all of these vaccines for free. And yes, it does include the RSV vaccine right there alongside a lot of other vaccines. But aside from the RSV vaccine, it includes things like the Shingles shot, the Tdap vaccine, hepatitis A and B, even if you're not at high risk, and measles, and a lot more. All of these vaccines are in the CDC's Advisory Committee on Immunization Practice list, and ever since 2023, you can get them all completely free. So no need to worry about your Part D plan's deductibles, co-pays, or co-insurance payments either. Now you might be wondering, why differentiate between Part B and D? Does it matter that the RSV vaccine is covered by Part D and not Part B? Well, you need to know the differences because if you don't, you could fall into one of two pitfalls. But before we look at that, let me just jump in here really quick and say that if you're learning something new, please hit the like button. This supports our channel, and it also helps this video reach other seniors who may need to see this to avoid paying $330 for their RSV vaccine. And if you're learning something new, go ahead and hit subscribe because we have a lot of informative and simplified videos on Medicare coming up. All right, now let's get back to the video. The first pitfall of Medicare vaccines is pretty simple. A lot of people assume that Medicare Part D, or drug coverage, is included in original Medicare and offered by the government. So they enroll in Part A and B, and they assume that that already includes coverage for prescription medications and for RSV vaccines. Now, original Medicare does not cover either of these. You need to enroll in a separate Part D plan, either as a standalone plan or as part of a Medicare Advantage plan. This is a common mistake that unfortunately a lot of seniors make and end up not only having coverage for Part D, but having a lifetime penalty. Now, the second mistake is a bit more complicated. You see, Part B vaccines are typically administered in doctor's offices, while Part D vaccines are typically administered in pharmacies. So if you get the RSV vaccine or any of the other Part D vaccines, for that matter, in a doctor's office, you either have to pay up front and request reimbursement from your Part D plan, or you may ask your doctor's office to bill it. Some offices will let you do this. However, and this is a big however, here's where a big mistake happens. A lot of doctor's offices end up billing Part B instead of Part D. You'd think that your doctor's office knows how to do this, but honestly, it's complicated and they work with a lot of different insurance. So a lot of doctor's offices, they bill Medicare Part B by default. And sometimes It doesn't occur to them that they should have billed Part D or your prescription drug plan instead. And when they do this, Medicare rejects it, and they send the claim back to the doctor's office. The office then in turn will send you a bill and say that Medicare rejected it. And unfortunately, a lot of people don't bother to contest it beyond that, and they just pay it out of pocket for themselves, assuming that they're responsible. And that's not the case. That's why whenever you get a Part D vaccine outside of a pharmacy, make sure that you specify that they need to bill Part D and not Part B. Or just avoid that altogether. Honestly, that's probably the easier thing to do. Get your Part D vaccines at a pharmacy, get your Part B vaccines in a doctor's office. This can save you hundreds of dollars, particularly on the RSV vaccine, which costs around $330 per dose. Now, this isn't a super common problem, but we do see it happen. And it's one of those confusing bits about Medicare that can easily lead you to make an expensive mistake. Now, speaking of expensive mistakes, if you want to learn about all the potential mistakes that seniors make before enrolling in Medicare, I created a free workshop that'll get you started on everything that you need to know. In it, you'll learn about the different Medicare plans, and you may be able to determine which one is best for you based on coverage and cost. So I'll leave a link in the description below if you want to check it out. Other than that, thanks for watching, and I hope that you found this video helpful.